Welcome everybody. We are excited that you could join us today for our community learning series, which will give you a preview of what to expect as a kinesiology student at UIC. My name is Joe Wagner. I'm one of the academic advisors for the kinesiology program. I'm joined today by Whitney Harris, our other advisor in the kinesiology program. Now, I'm very excited to introduce this week's guest, Mrs. Arbel. For our incoming students, she is actually the first faculty member you will meet as she teaches our KN 100 class. And she's also the advisor for our kinesiology club, so she's a very hands-on faculty member both in and outside the classroom. So without further ado, I will turn it over to her. Everybody give a big welcome to Ms. Arbel.
I'm very excited to let you know about really unique classes that you will be taking and in the kinesiology department. As Joe said, you will meet me probably for the first class for KN 100, which is an introductory to kinesiology and nutrition. I wanted to give you a little bit of background of where I come from and what did I do before I actually started to be in academia. So my journey started as a professional ballet dancer. I was dancing all over the world for over 20 years professionally. At some point, I decided to become certified so I could be able to teach dance. So I studied in England and did my degree with the Royal Academy of Dancing and did my teaching certificate. From there, I continued to explore ways of moving the body because I was so fascinated about movement as a dancer and wanted to know and learn more. I saw friends of mine getting injured and for whatever reason, and I was wondering why I didn't get injured, why did they get injured, and what was the issue with that. So it really intrigued me to continue, it was very intriguing to me to continue and looking into how the body moves, the biomechanics of the body, and everything that relates to it. I continued and explored more professionally and became a soft Pilates lead instructor trainer, which I did my certification in Canada for a few years, and I owned a certification center in Chicago that was certifying health and fitness professional to become Pilates instructors, basically, and continuing education for personal trainer, physical therapists, doctors, and anyone from the health and fitness profession. I owned the business for about over 20 years. And then when I entered academia in later time in my life, while I was a business owner, I've decided in 2016 to stop the business and move on to academia. But I just wanted to let you know, I was a student at UIC. I did my bachelor degree here. I did my master's degree, and I'm completing my PhD right now. So I've seen both sides of the UIC as an instructor, as a faculty, and as a student as well. So just a little bit of a background about me. So KN 100 is an introductory to kinesiology. Usually the introductory sessions, I really like to have the session more hands-on and involved and interactive. So just a quick question for all of you. What type of career do you think a degree in kinesiology prepare you for? If you can just put it in the chat box, that is perfect. Physical therapy, correct? What else? Any others that you can think about? Athletic trainer, yes. What else? Occupational therapy, very good. Yes. So all of the doctor, absolutely, yes. So all of the professions that you guys pointed out are all in the health, correct? So it's much more related to health. But kinesiology can offer you so many careers that you never thought about. And this is part of the things that we do at KN 100. We really explore all of your career options, and we do it really actively. So you are going to be doing activities in class and outside of class. You will be presented with presenters from the health and fitness profession. Most of them, I can say, some of them are graduated of ours actually that finished our degree and established their own businesses and are coming back to inspire our students actually to pursue different careers in kinesiology. So I put a little bit of a link here for the AmericanKinesiology.org that can give you an idea of the vast of careers that you can go into. And I really, this is kind of like giving you a little bit of more than what we posted. And you can see that it can really vary from any type of physical education to biomechanics, working either in a lab or working as ergonomics, which is, for example, being in an office and looking at people's positions and postures and how the furniture is related to their body, and being able to fix that so they will not have a lot of injuries. And other things that you can do is go into medical equipment sales, which is really big as well. You have all of the knowledge. One of my graduate students is actually working in operation rooms with doctors and showing them how to use equipment to trace cancer in the abdomen. Very, very interesting careers that you can choose from. Other things you can do and look into is if you're interested in working with people that do adaptive physical activity, for example, people who are in wheelchair or any type of conditions that are preventing them from doing just regular exercise. So I really want my students to really think wide and not narrow their mind. And even I always said that to my students, if you are choosing to be a chiropractor or a doctor, wouldn't it be wonderful to have a certificate in corrective exercise or in wellness or in personal training, so you can have a much more broader, comprehensive approach to your career. Okay. So the other class I'm teaching is KN243, and this class is more of assessment and programming. So what we're looking at is we're really teaching you hands-on. There's a portion of a lab for the class where you are learning all of the testing, and there is a discussion part where you're taking all of those testing and putting it into case studies, like real life scenarios that you are trying to figure out what type of testing would be working well for a specific scenario, and how are we going to correct posture or any type of issues with balance or strength or endurance. So I wanted to do a little bit of a thing with you, if you can join me. So when we talk about all of these components, range of motion, strength, endurance, and balance, if you think about it, of activities of daily living, and if people don't have a sufficient range of motion or strength or endurance and balance, how can it impact simple activities of daily living that we do? So for example, range of motion, if you think about the shoulder, and if you're trying to reach overhead and just put your arm up to the ceiling, you're probably doing it very easily. But think about somebody that have, for example, a condition of a frozen shoulder. So their shoulders are rotated in and it's frozen. If you're trying to move the arm that way, you won't have a lot of range of motion. And it can actually create a lot of pain. Or if you are in rotation in and you're trying to move your arm, you won't be able to get to a full range of motion. You create a repetitive motion that is going to eventually injure you. It's the same with the hip. If you think about walking, we need to clear the floor, right? We need to lift the foot off and on and clear the floor. But what about people that have issues with doing that? They don't have enough strength to do that. So we're really looking into all of these things and really life examples of how to take this information and not just learn it from the book, but actually make it really a real deal in life. Strength, we're talking about strength. Lifting something and just carrying it. Like if you moved an apartment lately, lifting a sofa. It's easy for us to do, but there's a lot of people that cannot do that. Or trying to stand up and sit. Very simple task. A lot of people cannot do this. If you go into a career of occupational therapy, you'll probably be working with people that needs to be restoring some functions, and one of them would be standing, from seated position. Endurance is another thing that is very important. How many of us can walk upstairs four floors without huffing and puffing, for example? Simple thing, but then we're learning all of the processes behind. Why do I breathe so heavily? Why this is happening? How can I improve that and improve my cardiovascular fitness? Or carrying grocery bags and holding them in your hands constantly in an isometric contraction without changing your muscles. How do the muscle adopt to do that? So many direction of assessment, a balance as well. When we're talking about elderly and falls, this is a big, huge field, and how to work with stroke patients that lost their motor and walking and regular things that they do every day. So all of these things and all of this assessment, and we're taking that and really correlating it to real life experiences. So I want to do a little experiment with you guys, because I don't like to stand and lecture only, and whoever will take classes with me know that I'm very, very active and hands-on. So why don't we do a little experiment now, okay? So I want you to sit properly to the middle of your seat, everyone, and I want you to cross your hands over your shoulders, and I want you to put your feet flat on the ground. And to my go, I want you just to stand up all the way straight and then sit down back and do as many as you can repetitions and as fast as you can. And count your repetition, and then I will ask how many repetitions you did. Is everybody ready? Here we go. Start. 30 seconds. Do it as fast as you can, as many as you can, and count them. We're almost there. We have 10 seconds left. You're probably feeling your quads. 3, 2, 1. Perfect. Okay, can you tell me how many did you do? 14. Good. What else? 16. Good. Perfect. All right. So 22. Okay. So 17. Good. So each of you has different numbers. So the reason for that is, and I'm not diagnosing anything here, so don't worry about the numbers that I'm just saying. But in general, there are norms. These are usually tests that we're doing for elderly from 60 and above. There is a range of age that you do the test for. You do it for men and women. And the reason why we do this test, it's a very simple test, but it gives us a really good indication of the ability to do motion for a prolonged time and the strength to get off the chair without hands, without holding hands or pushing yourself off. And it gives a good indication of risk of falls for elderly. So a test like this, you guys will be experiencing this type of test in the lab, and then we're going to really work on how does this really apply to real life, and you will just experience that doing it by yourself. Okay, so we're going to continue for the next thing. The other thing I'm teaching is posture and daily activities. So if you think about it, probably now because of COVID-19, how many of us are sitting in front of the computer so much longer, in front of the computer all day, shoulders are shrugged forward, elevated, you feel tension in your shoulders, you feel tension in your neck and your lower back as well. Posture is extremely important, and it actually relates not just to physical health, but mental health as well. So if we think about that, think about an ideal posture. How is it important to prevent pain, prevent injuries eventually, and how it impacts our daily activities? If somebody has a round spine forward and they're walking, from gravity, if they keep walking like this and they don't have enough strength, they will probably fall, right? Because the gravity is pulling them downward. So really important for daily activity. If we don't have a proper posture, we won't be able to actually do things during the day. And then looking into athletic performance, I'm sure all of you are working out and how important it is to have the perfect posture. For example, for squats, if you do squats and your knees are knocking in, that puts a lot of pressure on your knees and eventually will create an injury on one of your tendons in your ligaments in your knees. So very important to be able to properly do it, or lifting weights overhead. If you lift the weights overhead and you shrug your shoulders, you create a lot of tension in your neck by doing this. And with the weight, you can create an injury. So posture applies to everything, from sitting to eat, all the way to activities of daily living and to athletic performance. It is really important to improve posture for all elderly to prevent falls, posture at the workplace as well. One of my students, for example, did a project that he went to a real estate office. One of his friends was working there, and he looked at his posture while he was working on the computer all day. And he did a whole analysis. That was part of the project he was working with me on. And then he corrected his posture, gave him a corrective exercise program. And then once he graduated, by the way, he was hired by this office to do some workout for their office workers and improve their posture. So you can see how all of this teaching that I do relates to your everyday living, and it's not really narrowed to one direction. Another course that I'm going to be starting to teach in the spring is corrective exercise KN 445, corrective exercise for sports enhancements and rehabilitation. And this course is really looking at all of the knowledge that you already experienced in other classes at the department. So anatomy, biomechanics, any type of KN 243 and other testing and assessment classes that you can take. And you're going to put all of them together. Here, you're going to put an investigator hat on, basically. And you're really going to look for the source of the imbalance and what type of corrective program do we need to create for the person. So all of the knowledge before, you're going to actually synthesize this knowledge into the corrective exercise program and try to figure out, and this is kind of like a very early step for you to do things, because if you are going to be a physical therapist or occupational therapist or personal trainer or athletic trainer, these are the things that you will be doing on a regular basis. You'll have a question, which would be the issue, and then you have to figure out the solution for the problem. So all of these tools that you're going to be doing in this course will really assist you to advance yourself in the field. Any questions? Let me know if you have any questions about any of the things that I discussed so far. I also lead a study abroad program that is actually an embedded course, which is a very unique study abroad program. And there's another, Dr. Kumlili, another colleagues of mine is actually doing the same program to another country. So the Cambridge program started this past semester in the spring, and unfortunately due to COVID-19, we couldn't fly to Britain, but we're hoping spring 2021 to be able to do the program again. And this program was a very unique program. We looked into qualitative movement analysis. If you can see this guy right here is holding a little iPad in their hands and taking a video of the students. What students learn to do in this course is actually use technology to do motion analysis and movement, which is very unique. And this is a very big and growing field right now, especially with COVID-19 right now. I don't know if you had the ability to do anything with it, but for example, physical therapists or doctors do a lot of virtual meetings right now. A physical therapist, one of my friends who's a physical therapist, was actually taking videos of the person through a Zoom meeting with her device to see the movement and give them exercises to do at home and tell them what the issues were. So it's really a big growing, the telehealth is a big growing market. So this class would really teach you how to use the technology, look into forces. So it's not just the one that you can carry. We actually went to Rush Motion Lab, and we do have a lab on the West Campus as well, the biomechanic lab, where you can do analysis of forces as well when you're doing movement. That give you a good indication of how you load your joints. And then in addition to that, the students did interdisciplinary work with and collaboration with the performing arts as well. So it's a very broad class that allows you to see and look and analyze movement in different settings. So they were analyzing musicians, performers, dancers. We were supposed to go to the Joffrey Ballet, and obviously because of the COVID-19 we couldn't, but we are planning to run this class next spring. So students will have a little bit, it's a very big hands-on class, and then a component of it afterwards is done in England, where you collaborate with Anglia Ruskin University students and learn more about movement analysis through experts in England as well. I work on, in addition to teaching and doing being an advisor for students, I do a lot of research projects as well. So the two main ones that I'm doing right now, one of them is on East Campus and the other one is on West Campus. On West Campus, I'm doing more research with osteoarthritis of the hip, looking into ranges of motion of the hip, especially internal and external rotation of the hip with people with osteoarthritis and how it impacts their walk, their gait. And on East Campus, I'm doing research with a rotational device and looking into increasing ranges of motion, working with athletes and with regular population, and seeing if increasing range of motion of the hip will decrease injuries among athletes and improve their performance. And as you can see the photos here, these are students that went with me. I take students every year to the American College of Sports Medicine conference. This one was in Texas. We do this every year. They present clinical case studies or research that they did with me. This one was a research that Nikki did. She just graduated and she was accepted to occupational therapy school and started her studies already. And the other student works with Dr. Terry Nicola, who is at UIC and is a sports medicine doctor who gave them clinical case study, and they worked on it, created an abstract, and presented the clinical case study. So this is really, again, another way of hands-on and increasing your knowledge. And I can tell you, students that work in the field, either volunteering or doing research or enhancing their studies and academic study more, have a better chance to get into programs. And I can tell you from my experience, the students that worked on research and presented really had an edge on other students. And there are many other ways to do experiential learning to increase your credentials. Another thing that is kind of, I'm a supervisor, the faculty supervisor for the kinesiology club. So in addition to your academic everyday work that you do, the research, the experiential learning, you really need to think about getting more involved in what's going on in the department, either through clubs or any type of involvement that you can do. The Kinesiology Club is doing many events during the year where you can volunteer and work with them. For example, they did some volunteering and created like care packages for homeless and gave it away one year. Other thing is that they work as volunteers at the marathon, at the Chicago Marathon, or at the hot chocolate run. They volunteer at the Ronald McDonald home as well, and do some activities there. And they have big events every year. One of them is the annual career fair, where we have a lot of our alumni that have businesses and other businesses who come to really educate our students and give more information about the opportunities in the business out there after you graduate. And then Fit for Life, which is an inclusive big event, which we have a wheelchair basketball tournament that we have faculty and students playing against each other. And it's just a fun event with vendors and activities just to come together. And this one is for all of the clubs of AHS. We have, pre-PT, pre-OT, we have nutrition, the rehab sciences. There are many clubs that you can join in. So I would really encourage you to be part of it and get involved. Another way you can get involved that I am working with, I am the education chair for exercises medicine on campus. It's a program that is part of the ACSM, American College of Sports Medicine. And if you think about it, how hard it is to get people to actually exercise. If we can actually take exercise and put it in one pill, I'm sure everybody would take it on a regular basis. But to ask people to actually stand up and start doing it, it's a really, really big task. So I have an ambassador team of 4 people, and students who want to volunteer. We are actually working to improve movement on campus, to make campus a better healthy, mentally and physically place. One of the projects that we started last semester was with first-year seminars, and we started to create videos and some educational materials for first-year seminars across campus, and this is the thing that we're going to be continuing to do to try to really promote health and wellness and exercise by creating activities for first-year seminars or any type of short videos or any type of presentation. So this is another way that you can get involved in the department, and it's a very unique thing that you guys can do, not just a regular campus studying. So that's another way you can take it as an experiential learning and work with the team, with the ambassador team, to promote health and fitness, that's what you're going to be doing for the rest of your life if you choose the field of kinesiology. So I just wanted to kind of like summarize some things because we're kind of like running out of time. more than just a regular academic program. And I think that you could see the broad possibilities that you have through the classes, through the activities, through research that you can do in the department. It's not just coming and studying. It's a literally continuous motion towards your career pathway. And every year that you are in and every semester, you are exposed to more instruction, develop more new skills, and think critically of how to take all this information and implement it into the real world. And the other thing is we're always here. I'm very much hands-on. I'm very available for my students. I'm still in connection and relationship with students that left and they're graduated, but they're still in contact with me. And I'm always here to help and advise if needed. So thank you for your time, and let me know if you have any questions. I'm more than happy to answer any questions that you have.
Thank you, Vered. As we wait for student questions to come in, I have a question for you.
Yes.
What's your favorite thing about teaching at UIC?
Oh, the students. Absolutely. I think we have a really unique body of students at UIC. It's really a feeling of a family from perspective of the students and the faculty, my friends that I'm working with. So it's really not feeling like coming to work. It's really about coming home to your family. And that's how it feels for me every day. And I'm really trying to encourage and create this environment for the students in the classroom as well. So, and create this passion, the same way I feel about this. Oh, out of curiosity, what are the norms? So for men, anything below 14 would put you in a risk for fall, and for women below 12. But this is one test, so it can't really give you indication, even if you did 14 today, because I did that too, by the way. I did 14. Because there are other battery of tests that you need to do together with it in conjunction to make the decision. So it's not just that one. You're welcome. What is one small thing everyone can do to improve their posture? That's a great question. Okay, so when you sit, I'll just take something that we do every day, right? So when you sit in front of your computer, you shouldn't have your legs crossed. You shouldn't slouch back like this. You should actually sit towards the edge of the chair and put your feet flat on the floor. That's a great question. Put your feet flat on the floor, and when you put your hands in front of you, make sure that you are doing this before you actually put the hands on the keyboard. Lift your shoulders up, circle them back, drop them down. Feel like you have two oranges underneath your armpits, and work like this. And once in a while, you really need to move away from the sitting position, and you need to change it. So if you're in this position, you want to do movements that actually counterbalancing what you're doing. So if you're forward, you want to do movements that go backwards actually, and stretch a little bit, change position from standing to sitting. So all of these things. I have my leg crossed. Yes, I know, I do too. Guilty as charged. Yeah, so make sure that, just be aware of it. Posture is really awareness. It really starts with awareness. Where your shoulders in relationship to your hips, to your legs, where is the head, is it forward, is it back? And you will feel areas in your body where are much more tight, which will give you a good indication of what you're overly working and what you're underly working. Any other questions? I'm more than happy to answer. And I have my information as well, so you can definitely contact me if you need, if you have any other questions. I'll be more than happy to answer them.
Vered, I have one more question. sometimes in office settings, you see people sitting on those giant exercise balls, and I've even seen chairs made like that. Like, what's the benefit to doing something like that, or do you recommend that versus the posture tips that you just recommended?
Yeah, so with respect to the ball is really great, but you don't want to do it, for a long time. I really believe in moderation in everything. The ball works on your core muscles, so it helps you more stabilize, and it's less of a harsh surface to sit on. So your sit bones and your sacrum area are a little bit less, less pressured when you're sitting on a ball. But if you're sitting on a wobbly thing all the time, it makes your muscles worse constantly. So it's good from one end, but on the other end, it can get fatigue, and then when you get fatigue, you can lose your posture, your proper posture. So I would say, yes, sit on the ball, sit on a regular chair, stand up, change all the time, definitely. They're all good in moderation and being aware, with awareness to the posture where you're at.
All right. Well, doesn't look like we have any other questions, but still feel free to put them in the chat box while I talk. Thank you, everybody, for coming today. Thank you, Ms. Arbel, for joining us. This was super informative. I enjoyed it very much. Feel free to follow us on Instagram and YouTube at UICAHS. There's our contact info there as well if you want to take a picture of that or do a screenshot of it. We are going to be doing these every Wednesday for the rest of the month. We wrap these up at the end of July. Next week, we're going to be doing one on sports medicine, the role of athletic trainers in professional sports. We're actually going to be talking with an alumni of our program who is an assistant athletic trainer for the Chicago Bulls. So that'll be super exciting. So please join us for that. And don't forget, if you haven't done so already, if you are an incoming student, there's still time to finish your orientation and see me and Whitney to get registered for classes, to get ready for this fall. It's sneaking up on us pretty soon here. But yeah, we will hang out for a few minutes to answer any other questions that may come in. But otherwise, thank you everybody for attending today. And thank you again to Ms. Arbel. And we look forward to seeing you guys on campus.